Bone Embryology and Bone Circulation. Published by WordPress.com. Embryology of Bone Development. Limb bud development. 4 weeks of gestation. Limb buds form as outpouchings of the lateral body wall. Arm buds, opposite C1T2. Leg buds, opposite L2S3. Development influenced by interactions between apical ectodermal ridge, AIR, regulates proximal to distal growth. Zone of polarizing activity, ZPA, regulates anterior to posterior growth. Controlled by FGF, BMP, and sonic hedgehog genes. Finger and toe rays appear during the 5th week of gestation. Chondrification. 6 weeks of gestation. Mesenchymal condensations chondrify to form hyaline cartilage models of limbs and digits. Chondrocytes differentiate from mesenchymal cells. Angulations divide each bud into 3 segments: upper limb, arm, forearm, and hand. Ossification and segmentation. 8 weeks of gestation. Cartilage, being avascular and deformable, undergoes ossification due to hypoxia. Blood vessels invade cartilage, carrying osteoblast and osteoclast precursors, forming the primary diaphyseal ossification center. Periosteal bone sleeve forms circumferentially, initiating intramembranous ossification at the midshaft. 9 weeks. Rotation of limb buds occurs. Upper limb, adduction plus external rotation, flexor surface anterior, thumb lateral. Lower limb, adduction plus internal rotation, flexor surface posterior, big toe medial. Vasculomesenchymal canals appear, creating primordial bone marrow. Secondary ossification centers. Appear in long bones after birth, e.g., distal femur may develop before birth. Form at bony ends, most ischemic areas, separated by the growth plate, physes, from primary ossification centers. Types of bone formation. 1. Endochondral ossification. Bone forms from a cartilage model. Process. Chondrocytes produce cartilage, which is absorbed by osteoclasts. Osteoblasts lay bone over the cartilage framework. Occurs in embryonic long bone formation, longitudinal growth at the physes. Distraction osteogenesis. Non-rigid fracture healing. 2. Intramembranous ossification. Bone forms directly from mesenchymal tissue without a cartilage model. Occurs in flat bone formation, periosteal appositional growth. Types of bone growth. 1. Longitudinal growth. Increases bone length. Occurs at the physes until closure. 2. Appositional growth. Increases bone girth. Occurs at the inner layer of the periosteum. And 3. Growth in small cuboidal bones. Through interstitial cartilage proliferation and appositional growth. Defects in bone formation. Achondroplasia. Failure of endochondral ossification. Cleidocranial dysplasia. Defective intramembranous ossification. Vertebral and nerves development. Somites differentiate into dermatomes, skin, myotomes, myoblasts, muscles. Sclerotomes, vertebral body and annulus fibrosus. Neural tube, develops into the spinal cord. Notochord, becomes the nucleus pulposus. Neural crest cells, form peripheral nerves, spinal ganglia, and the sympathetic chain.